Have you ever really stopped to think about the pill you take for a headache? Or the prescription that keeps you healthy? Well, each one has an absolutely incredible story. Today, we're pulling back the curtain on the fascinating, high-stakes journey of a drug, from a tiny idea in a lab all the way to your medicine cabinet. All right, so here's our game plan. We're going to start with the absolute basics, the science behind it all. Then we'll walk through the grueling development process and see what happens when things don't go as planned. And finally, we'll look ahead to the amazing future of personalized medicine and ask the big question: who pays for all this innovation? Right. So, first things first. Before we can talk about making drugs, we have to understand the fundamental science that makes it all possible. So, what exactly is pharmacology? In simple terms, think of pharmacology as the official rulebook for how medicine works. It's the science that explains what happens when a drug enters a living body. It answers the fundamental how and why behind every single medication we rely on. It really helps to think of this as a two-way street. On one hand, you have pharmacokinetics. That's what your body does to the drug, how it absorbs it, moves it around, and eventually gets rid of it. On the other hand, there's pharmacodynamics, and that's what the drug does to your body, its actual effects. You absolutely have to understand both sides of this equation for a medicine to be safe and effective. Okay, so now that we've got the basics, let's follow a potential new medicine as it enters what can only be described as a gauntlet. I'm talking about the long, incredibly challenging, and wildly expensive process of drug development. This whole journey is a true marathon. It kicks off with discovering maybe one promising compound out of thousands. Then comes preclinical studies to test for safety, where we're seeing a really important shift towards using in vitro studies instead of animals. Only if it passes that stage can it even be considered for human trials before facing the final judgment from regulators. And the human testing part? Wow, that's another marathon in itself. First up is phase 1, where you're just testing for safety in a handful of healthy people. If that goes well, you move to phase 2 to see if the drug actually works in a larger group of patients. And then comes the big one, phase 3. We're talking hundreds, even thousands of patients, sometimes for years, to confirm it works and to catch any rare side effects. And this right here is the price tag of all that work. Back in 2010, getting a single new drug approved cost an estimated $1.8 billion. And that number has only gone up. It's a staggering figure that really drives home the immense financial risk involved in this whole process. All right, so let's say a drug survives the gauntlet, it gets approved, it's out in the real world. Now what? Well, this is where things get a lot more complicated, and sometimes even the best drugs can have some bad outcomes. This quote just hits the nail on the head, doesn't it? Every single medicine is a balancing act between benefit and risk. The very same power that lets a drug heal is what also gives it the potential to cause harm. The whole field of pharmacology is a constant effort to tip that balance in the patient's favor. The term adverse drug events is actually a big umbrella. It covers everything from simple medication mistakes to a drug just not working. But the really serious ones are adverse drug reactions. That's when a person has a harmful effect from a totally normal dose. Get this, those reactions alone are the cause of 3/4 of all hospital stays related to drug issues. But here's the kicker, and it's a really important one. A huge chunk of this harm doesn't have to happen. For older folks, who are often on multiple medications, up to half of all these adverse events could potentially be prevented. That's not just a statistic. That's a massive opportunity to make medicine safe. So if a one-size-fits-all approach has these built-in risks, what's the solution? Where do we go from here? Well, increasingly, the answer is written right in our own unique genetic code. And this brings us to a field that is an absolute game changer: pharmacogenomics. The whole idea is to stop treating just the disease and start treating you, the individual. By understanding how your specific genes change your response to a drug, doctors can tailor your treatment, boosting the good effects while cutting the risk of the bad ones. So how does this actually work? Well, a perfect example is the CYP450 gene family. Think of these genes as the instructions for building little factory workers in your body that process drugs. Now, a tiny variation in those genes might mean your factory workers are super fast or really, really slow. This completely changes how a drug works for you, and it's exactly why the same pill can be a lifesaver for one person and practically useless or even harmful to another. So, where is all of this amazing science headed? Let's take a peek at the trends that are shaping the future of medicine. And, just as importantly, let's look at the complex economic engine that's footing the bill for all of it. Personalized medicine is clearly the headliner here. But check this out. Two other trends are gaining some serious momentum. Drug repurposing is this incredibly clever idea of finding new uses for old, already approved drugs, which saves a ton of time and money. And then there's AI and big data, which are poised to completely revolutionize how we discover and test new drugs in the future. So where does all the money come from? Well, it's not just one source, it's a critical partnership. You can see here that government groups like the NIH are the huge piece of the pie. They're the ones funding that early, high-risk, foundational science. After that, private industry jumps in with the big bucks to fund those massive and expensive clinical trials. And this table just breaks it down perfectly. Each player in this ecosystem has a distinct and totally complementary role. The government takes the initial risk on bold new ideas. Charities swoop in to fill critical gaps, like for rare diseases that might otherwise be ignored. And industry provides the enormous capital needed to get these drugs over the finish line and into the market. The whole system just doesn't work without all three. And all of this brings us to one final, crucial question. The science is moving forward at an absolutely breathtaking pace. But as we create these incredibly powerful, personalized medicines, we're faced with an equally important challenge. How do we make sure these life-changing innovations are actually accessible and affordable for everyone? That's really the key question we need to ponder as we step into this exciting new era of medicine.